3 years ago, I had a knee replacement, and while I was in hospital, they discovered that my blood pressure was really high, and they told me to see my GP when I get out and get him to sort it out for me. I saw my GP. Then over a course of about 6 months, nothing really was happening with it, and then I was referred to you. I've had blood pressure for approximately the last 7 years, which seemed to be being controlled with the medication, but as I say, 2-3 years ago, it then suddenly changed, that the medication just wasn't seeming to work. I can hear my heart beating all the time, bum, 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 bum. As I'm talking to you now, I can hear it in the, it's not a background noise, it's a real thumping noise. And of course, the rest that you get with it, tiredness, and just lack of wanting to do anything really. Constant headaches, which I've got now. Even talking to you, I've got a headache. I put on weight as well. I don't know if that's a significant part of it, but it just makes you very, very tired. I haven't slept properly now for years.
We know that your blood pressure is extremely high most of the time, with figures of over 200 systolic frequently measured in you over 24 hours. We can't find a cause for your blood pressure, and you're here really to talk about this new procedure, renal sympathetic denervation, okay, which we know can lower blood pressure quite significantly in people like you. Okay, it's a procedure that we do in the cardiac catheterization laboratory. We put a little tube in the top of your leg, we take pictures of your renal arteries, and then we treat your renal arteries with radiofrequency energy. What that does is it interrupts the automatic or sympathetic nervous system that supplies your kidneys, and that's quite an important driver of high blood pressure. And what we know is that when we do that, in the majority, not all, but the majority of patients see quite a marked reduction in their blood pressure in the order of approximately 30 over about 12 millimeters of mercury drop on average over quite a long period of time. Okay, it's a new procedure. You'll be one of the first, as it were, in the UK having the procedure. We would expect success in about 85% of patients. So in 15% of patients, for some reason it doesn't work. It lasts for at least 3 years, possibly 5 years, okay, after this, but the effect can take several weeks to come on. So although you may have the procedure today, it may be a few weeks down the line until we start seeing a response in your blood pressure, okay? It's a relatively safe procedure. The only real common complications are from bleeding around where we put the tube in your leg, okay? We will aim to close that with a special device to minimize your risk of bleeding and to allow you to get up and about a bit quicker, okay? The procedure is quite painful when we apply the burns to the arteries, and because of that we'll use quite large doses of both sedatives and painkillers for you, okay? Barring any complications, we generally do it first thing in the morning and allow you to go home later in the day.
You say that it's not an instantaneous effect that you get from it?
It can be in some people,
yeah.
But in the majority of people we see the blood pressure reduction occur usually over a period of weeks, sometimes months after we've done the procedure.
Would I still have to keep taking my medication?
Yes, and most people do continue taking their tablets after the procedure. We're not entirely sure what happens if we see success when you stop the tablets, but this isn't about getting you off your tablets. It's very much about trying to get your blood pressure down, so you will stay on your medications more than likely.
Would that be reduced in any way, or would it stay at the same?
We may do. In some people, we're seeing after a long period of time after the procedure, some of the doctors are cutting back a little bit, but it is highly unlikely that you'll come off all your tablets for blood pressure, and we're not really seeing that in the people that get the procedure
So hopefully
done.
the effect of this will be over the next few months then?
Hopefully, yes.
Oh, good.
But as I say, in 15% of people, we don't see that reduction, and we don't really know why.
If it did not work, where do we go from there?
That's a very good question, because this is basically, you're in a position now where there is no alternative. You're already on 8 different tablets, your blood pressure remains extremely high. And if the hope is that this will work for you, because it is very much the last resort, and that's why this was developed. As you know, blood pressure is a risk for things like kidney disease and heart disease and stroke. So that's why we think it's very, very important for people like you to be considered for this procedure, because it is proven to be quite safe and quite effective.
And how long does the procedure take?
It'll take us about an hour,
Right.
probably shorter than an hour, but we make sure that you've got plenty of sedative on board first, but from when we put the tube into finishing the procedure is usually about 40 minutes, so yeah, about an hour in total.
And hopefully I'll be able to go home today?
Hopefully home later today,
Oh,
yeah,
that's
barring
lovely.
any complications.
That's
Okay.
Yeah, that's fine, thank you.